Hi, everyone. This is Mark Anthony with Dr. Bryce Cunningham. Thank you so much, everyone, for being here on the Edge on Regen Medicine show. As you all know, we are focused on helping you, helping your loved ones, helping your friends and family. And I love to talk about phenomenal doctors that are into regenerative medicine. And I believe that regenerative medicine needs to get out there more. And that's why we do the show, from talking about stem cells, talking on peptides, talking on neuropathy. We talk on everything and anything that can help people get out of pain and live the life that they're supposed to be living in this world, because we only have one world. I mean, one life and one world, that too. But with that being said, I just want to say thank you so much, Dr. Bryce Cunningham, for being here on the show today.
My pleasure. Happy to be with you.
Hey, we are excited. And before we start, everyone, since you all know this is a live video, sharing is caring, make sure that you share it. Even if you're not in pain, remember, even if you're not in pain, people, by you sharing this, you'll be able to help at least one person. And if it's worth that one person, you know, life is worth living. So before we get into this, we're going to be talking about stem cells. I love stem cells. I've never used stem cells myself, but I have a lot of close friends and family that has benefited from it. And so today we'll be talking about regenerative medicine. And what I want to ask you, Dr. Bryce, is how did you get into regenerative medicine, period?
Wow, it's a good question. So that's kind of how I got into chiropractic too. It was from a loved one, a family member, who had health issues that was able to get amazing results with chiropractic. About 5 years ago, we integrated, and shortly after that, regenerative medicine was something that came on the scene. Well, my father had his left knee replaced, and you know, they tell you the recovery is about 6 months. You know, some people quicker than that.
Right.
His was a year before he had less pain in his knee after the surgery than before. So needless to say, he did not want to endure that again. So he had a right knee that they wanted to replace. So we were looking at ways of helping him. There was things we could do that were palliative. So that's when we stumbled upon regenerative medicine, saw the amazing results with that, and the rest is history.
So how long did it take to see results with your father?
Well, you know that he's pretty skeptical because I'm his son, you know, what do I know type thing. So
Yeah.
actually, that's one thing that we did video, because I wanted to see for myself, you know, what we could produce, what kind of effect, change we could bring about. So we videoed him walking, and you can see it in his face, his energy level, everything. You know, he was pain, he was hurting. About 5 minutes post injection, he had less pain. Wow. And better mobility. And you can actually see that's one thing that we were able to capture on video.
Wow. Now, are those normal results, or is everyone just different?
Well, I'd like to say that happens in every instant, but that's not always the case. So, you know, certain patients can get results before they leave the office, but typically you're looking at about 4 to 6 weeks before you I would say on an average, patients notice an appreciable difference.
Okay, awesome. I actually just got a text for somebody on Facebook, and the question they had was, what is the value in doing regenerative medicine versus other options?
Wow. So value, that's the key word there. Certainly there's other remedies and treatments out there that we've been using for years. Sometimes the results are short-lived, an injection, a steroid injection. Regenerative medicine actually gets to the root of the problem. If we're majority of the time we're talking about degenerative, damaged parts of the body, we want to get to the root of that problem and bring about healing and repair. So as far as the value, it's head and shoulders above what else is available out there. Practically anything else, you're just managing the symptoms as the underlying condition continues to degrade, degenerate, and get worse.
What are when you have had a stem cell injection, I hear a lot of terms, one and done, or I hear where people just come every couple months. How would that work, or what would that look like if someone were to go to your clinic and start working with you?
Okay, so the one thing about treating the human body and treating the public is that everybody's different.
Okay.
Everybody's different. So you were asking earlier about how soon will you see results? Sometimes immediate, sometimes in a matter of weeks. As far as getting the changes, those things can take time. I'm sorry, I forgot
Don't worry about it.
your question. It was close to that, but you were asking specifically about what? One and done. That's what it was.
Yeah,
so one and done. So yes, for some patients, one and done. They're good to go. Some patients, they've struggled through the problem. They pushed through the pain. I can appreciate that. I was raised that way.
Right.
Push through the pain, keep going. And, that can serve a purpose, but if you continue to push through the pain to the detriment of the joint, you break it down to a point to where it's going to need more attention. I like to use the leaky roof analogy.
Right.
You can patch it, and it'll get you by. You keep patching it, but eventually, it's going to take longer to correct, and usually it's going to cost more in the long run, the longer you wait. So for those patients, yes, there's other things. Fortunately, we're able to still deliver results. It's not that we have to boot you out the door, but there's other treatments and modalities that need to help facilitate and bring about the type of results that they're seeking.
And how long has stem cells been out in the market?
That is a good question. I don't have a firm number for you. I know that they've been utilizing it for at least 10 years.
Yeah.
But research and trial stuff has been around much longer.
I know that there was a big push for stem cells when Mel Gibson's father was basically on his deathbed.
Yeah, I heard about that, and also Michael J. Fox.
Yeah.
He was leaning on President Bush to make that available to the public. People were traveling to Europe and spending obscene amounts of money to try to receive those type of results. And so now, it made sense to just make it available, have some criteria and guidelines around it. It's not appropriate for absolutely every situation, and but now we can utilize it in the United States, and it is overseen by the FDA. But thank goodness, because we're able to get changes with patients that otherwise in the past we just weren't able to bring about those type of results.
Oh yeah. So yeah, my dad has a little shoulder issue going on, and I've been telling him, you need to get stem cells, man, before at least it's too late. Because I know that if it's bone on bone, you got to start being really careful. Can you guys treat bone on bone or with the stem cells, or how does that work?
Well, you have to have some cartilage
Some type of
still
coverage.
there in order for regeneration to take place. So it signals the body for repair, and those are the patients that you're talking about using some other tools like the knee on track, the knee decompression to help
Right.
open up that space to allow the healing and regeneration to occur. But the longer you wait, the more damage, and the less options are available. Simple as that. If you have tears in the shoulder, and it's just like a piece of paper, you get a piece of paper, and it starts to tear, right? Well, that piece of paper is not going to be as strong, and you keep putting tension on it, and then once it tears in two, they have to be reattached, and that can only be done surgically. Stem cells are great, right? But if you wait too long, then your options become more limited. And if surgery with major tears, just so you know, you're looking at, our physician assistant, Jim Rosales. He's had well over 20 years of experience with orthopedics. He used to do the replacements, the surgeries, spines, hips, knees, shoulders, and he'll tell you, he's blown away by the results we're able to achieve. But he'll tell you that, surgery, it's two parts. First part, is enduring the surgery, going through it, but then the second part is the rehab. Mm-hmm. And if you don't do the rehab, the results tank. Even with doing the rehab for a shoulder with major tears, you're looking at 6 to 12 months of rehab.
Oh, wow.
I don't know about you, but that would dramatically change my life and my lifestyle if that was something I had to go through. Then on top of that, the success rate, even after going through all that, is about 50% at best, based on the research. So, surgery is definitely last resort. Unfortunately, we only accept patients that we can help. That's why we get such great results overall on average. So if that's the case, we'll certainly let you know. But
so you're saying that there's about a 50% chance. So let's say if you're going to get you're going to go to the doctors and they're going to do surgery, you said there's about a 50% chance rate that person's going to feel a little bit better, right? Or feel better.
Right. With major tears, that's what the research shows.
What would the research be for stem cell? Is it pretty high?
Yeah, well, I will tell you that they're still working on research for that. All I can speak about is what we've seen in our practice. And the success rate, conservatively, is over 80% success rate. If we accept you, of course, we do our assessment exam to see, what we're working with. But if we're able to accept you as a patient, we're determined to deliver those results.
I'll tell you, if I was somebody that had a knee problem and I heard 50% and then I heard over 80, that's a no-brainer. If you have to think about it, we have problems. You might need more than a doctor anyways. But
yeah, right. Well, that's when it comes to value. That's what we're talking about. As far as value, there's nothing that compares to that. Does it cost more than some other treatments, therapies that are available? Well, absolutely. But we're talking about value.
Right. And now with stem cell, there's no insurance, I believe, at this time, right?
At this time, you're correct. Okay. But so
no
insurance coverage.
I just had another text come in from somebody, and they said, "How should I behave or treat the joint following treatment?"
Okay, so you have that patch in your yard there that you walk across on a regular basis, and the grass is worn down, and essentially you're trying to get that to fill in and repair, right? Much like if you were trying to repair that spot on your lawn, where you can fertilize it, you can water, you can give it sunshine, and you're going to get those type of results. But if you keep walking and keep putting stress on that area, it's going to make it more challenging to get that to fill in and repair, because we're talking about damaged, torn tissues. If it's micro tears, if it's cracks, if it's fissures in the tissue, you want that to fill in. You want that to come back together and heal and repair. So it takes about 4 to 6 weeks for the cartilage to start to show up on the scene. So even though some patients leave the office right after the treatment, they're like, "Doc, this feels great. It's, everything I thought it would be and more type deal," right? We have to have them pump the brakes. You still got to give it time to repair. Understand what we're trying to accomplish. You can take a drug and knock out the pain, usually, right? So we're not just about getting them out of pain, but delivering the overall functional improvement so that, yes, your pain is less or gone, but now your functional level, now you're able to do those hobbies again, work around the house, spend time with your family.
I see where you're coming from, and I feel like a lot of it, and I hate to say it, but a lot of it's like common sense, but some of us don't. When we're in pain, we don't look at it as in common sense until we actually hear about it the way you explained it, because it makes so much sense. I mean, if you're putting so much traffic on something that's, like say if your body is a bridge, you're continuing to do the same thing over and over, it's going to eventually it's going to cave in. And a big question that I did have to ask, a personal question, was, so let's say somebody gets stem cell, what do they need to change their diet or eating habits? Or things that you recommend for it to stay strong?
Certainly. So there's, of course, eating a good balanced diet, making sure that you have all the vitamins and nutrients that your body needs to utilize to create healing and repair, because that's what we're doing. We're helping your body heal and repair.
Right.
It's always trying to do that, but it can't heal faster than it's breaking down. And that's where these patients are. So we're giving them that boost. So if you make sure that you have good vitamins, good nutrients, good balanced diet, of course, smoking, those kind of things are going to slow or decrease healing and repair, because your body needs oxygen, right? And when you smoke, well, then the oxygen levels in the body are less, right? So diabetics. So if we have a patient that's diabetic, we already know that those patients are slow to heal. So it can make things more challenging. Majority of patients, though, with diabetes, usually it's type 2, meaning that it can be controlled by diet. So those things kind of go hand in hand. So certainly there's things that can be done to boost healing and repair. And then even after that, there's also modalities such as cold laser therapy. Speeds up healing 3 times faster than the normal rate of repair. I know not all offices, but at least in our office, we also utilize PRP, or platelet-rich plasma. And that concentrates the patient's healing ability 6 times the normal rate. Is what
helping the blood flow.
Yeah. So boost, fertilize the stem cells as they're signaling for growth and repair. And that's why we get such amazing results. Tiger Woods did this, right? He had back surgery, right?
Oh yeah, I remember that.
And so after the surgery, that's one of the things that they used was a PRP before they completed the surgery. So it worked pretty good for him. I mean, he just won the Masters last year, right? So
not bad.
It worked pretty good for him.
Then again, he is Tiger. Oh wow! So would you say that all stem cells are equal?
No, and when we say stem cell, that term gets thrown around quite a bit. So
mesenchymal cell?
Yeah. There you go. So mesenchymal stem cell. So you can get mesenchymal stem cells from, of course, amniotic fluid, the lining of the placenta, or the umbilical cord. The most abundant, rich, robust source is from the umbilical cord. So we use umbilical source for our regenerative medicine, if you will, our regenerative cell techniques. Because sometimes, stem cell is, like I said, that term gets thrown around quite a bit, and we really don't know what we're talking about. So to be more specific, we'll just refer to it as that. So.
Okay. The healing cell.
There you go.
I know that it's hard because you have, your pros and your cons, and then you have your fake news and then your real news out there. And I know that there's not all stem cells or mesenchymal cells are the same. I know that you have some that you can take from the fatty tissue. Is that correct?
Yes.
And then there's, of course, different age cells that you can utilize. And I've known that there's been some people that have tried it and it did not work. And I know that it was because of the type of cell they used. And that's why I said, it's not created equal. And I just don't want, I just don't want to see people not start to utilize this because of someone's bad press that they use and they didn't get the correct, cell that they should have used.
Absolutely, and I'm glad you brought that up. You're absolutely right. When there are techniques where you can harvest these cells from your own body, like you said, adipose fat tissue, bone marrow, okay? Those are pretty invasive procedures. You still are harvesting or getting mesenchymal stem cells, but they're your own. And whatever age you are, whatever toxins, insults that your body's been exposed to, so have those stem cells. So if you can get them from a rich, robust source with a brand new and ripe for division and repair, would you agree that makes the most sense? You want the most powerful, the most efficient manner to correct a problem. That's why using those sources are heads and tails above the rest. Now, I know that usually the next question that follows is, well, but I want to use my own stuff. Does it have to be matched like blood? Not at all, Mark. These cells are immunologically immature, meaning they don't have any markers from the donor. When we put them in the area that we're working to boost regeneration, your body sees them as your own. Yeah. And hey, where have you been? Let's get to work, And so, so there's nothing to risk, nothing to worry about there. And you want the best. Now, you do that compared to trying to harvest your own. Not only do you have to undergo that procedure, but you'll have to do that multiple times to equal the same amount of regenerative power you're able to achieve with those fresh, new, robust umbilical mesenchymal cells.
Wow, it's funny because it's not just cut dry. There's a lot to it, and I've talked with people, and I've kind of had to tell them kind of the same thing that you said, but maybe not as in depth. And it's kind of like, all doctors aren't created equal. All pizza guys aren't created equal. I mean, there's always, someone that's maybe not as passionate about their job. I hate to say, but we live in a world that's not, sunshine and rainbows all the time. One thing that I have noticed though is the most successful doctors that I've seen that are doing this are the ones that I normally see a lot out there. I'll see they have like testimonials, and when you have that testimonial out there, no pun intended, but when you have that testimonial out there, it literally shows them like, wow, if it's working for them, it's going to work for me, so
absolutely.
But where I was kind of going with that is that I know that stem cells we're just barely on the cusp of what stem cells can actually do. I heard just recently they got a half a heart of a human heart, and they did a stem cell and it grew back the other half. So, I mean,
there you go.
Now they're doing it on the eyes, and I'm like, oh my Lord, like what else do we not know?
Yeah.
It's just amazing, and so, what I want to do is I want to just say to viewers out there, Dr. Bryce Cunningham is one of the top, in the Texas area. We have his phone number on the screen. We have his website on the screen. Reach out, call him, see what he can do for you. Again, I know he was just saying they don't just accept anybody, I believe, not just anybody.
I wish we could, but we're about getting results. So, we want to make sure that the patient has the best source of treatment and what's most appropriate for what they're dealing with individually.
No, exactly. And where I was kind of going with my conversation with you was that don't let one bad apple ruin that whole box of apples that you go buy at the store. Just because there's one bad apple, what you do with that one bad apple? You take it out and you take the rest of those good apples and start with your life. So my encouragement to everybody out there, don't let somebody else ruin it for you. This stem cells are helping people, and make sure you guys call Dr. Bryce Cunningham. He's a phenomenal man and very passionate about helping people and getting their life back. And again, everyone, make sure you share this. Sharing is caring. And thank you so much, Dr. Bryce, for being on our show.
Thanks for having me. It's been my pleasure. Appreciate it.
Appreciate it. Now, hey, that wasn't so bad, was it?
No.
You know, just like you're just having a conversation, you know. It's amazing with stem cells, and that was no joke. When I saw that, I flipped out. I was like, what about the other heart being, created, and it was identical at the other end. So I'm thinking, like, what are we missing? Like, what is there something else that we could be adding with what we're doing?
It's just like with, I don't know, several things in my life. I didn't know. I was raised in a family. I didn't know what a chiropractor was. My dad hurt his neck, and after a year, our next door neighbor was an MD, and great MD, but he was doing traditional stuff, meds, rehab, and my dad wasn't getting any better. A year later, he finally went to a chiropractor because he was like, "I'll try anything," right? And after a few visits, he had less pain and better mobility. And so the chiropractor told him to bring me in because he knew I had asthma. My dad's like, "Well, how in the heck can you help with asthma?" "Well, I don't know, but you help me." So that's how I ended up going in. I was on 3 prescription drugs a day. After a month of care, I got off the medication, and I was like, "Man, this is cool." And I knew then that's what I wanted to do. So again, it was within our body. So to get back to what you're talking about, it's always been within us. We're always looking for something outside a drug, a potion, a chemical, and that healing ability that's innately in us. We're finding out where it's stored, where it's obtained, and if we can get it and reuse it and spread that around, that's what it is.
Wow, that's amazing. I'm so glad I kept it recording. Anyways, oh boy. Anyways, I'm not even joking, but no, that was amazing. We should have started out with that one.
My name's Art Cardenas, and I came here because I've had problems with my knees. For the last 8 years, I have been in pain while I walk, hurting. It's been just a lot of pain while I'm walking. Well, my wife talked to me about this stem cell, and I was kind of leery about it. But listen, when I came here, they came in here, they said it's just going to be right away, instant new knees. But listen, I've been praying for some new knees, and I'm telling you, I've got new knees. It's only been 5 days, and the knee that they did first, I have no pain. I'm walking around like I've got a brand new knee. They just did my second knee, and man, I am telling you, I'm already feeling better. It is amazing, this stem cell for your knees. If you got pain in your knees, you need to come right here and get this thing done. In a day, you'll feel better. It's been a blessing. It is, I'm telling you, it's a miracle.
Hi, my name is Dana, and I'm down from Alaska. I came down to Texas to get stem cells put into my knees. In Alaska, I was told I needed total knee replacement in both knees. And people that I had talked to said it was very painful, very long recovery time. And I'm Alaskan. We don't have time to spend three months recovering. So a friend of mine recommended coming to Texas, came to Texas to Superior Physical Medicine, and it has been a wonderful experience. I feel like I have a new lease on life. I can move, and looking forward to going back and hiking and getting my life back. My life had been on hold because of knee and joint pain. That's gone. The procedure is quick, simple, easy, and the benefits far outweigh the airline ticket to Alaska, from Alaska.